Hello, I'm Krystal, and we're here on the third day of the ISPRM Vancouver Congress. And I've here with me Pete Skelton, who has just done an excellent keynote lecture on disaster response, preparedness, and health systems. Pete, thank you for joining us today. Can you tell our audience who couldn't join us today some of the main points of your lecture?
Sure, yeah, absolutely. So I think the main thing that we've been talking about today is simply the fact that as rehabilitation professionals, we're just not included at the moment in emergency preparedness. And if we're not appropriately prepared, we're not going to be in a position to respond as well. So we outlined the critical role that we play in response. So we know that we are key to improving patient outcomes. We know that we're key to making the emergency response more efficient as well. But at the moment, because we're not involved in preparedness, that means we face a lag in terms of how quickly we can get involved in response. So what we've also done today is we've set out steps that people can take on an individual level, on a facility level, and on a national level as well to better integrate rehabilitation into preparedness. And coming up later this year, we're launching a toolkit as well, which will actually help people to take that forward themselves.
That's very exciting.
Yes, it is, yeah.
Can you tell us why historically disaster preparedness and response is not well integrated?
I think it's something that's been improving over time. I think people have a fundamental misunderstanding sometimes of the role of rehabilitation. They see it as something that begins later in the process. And what we're saying now is that actually rehabilitation has to begin immediately. So early rehabilitation within the acute response. So starting during acute care in the hospital, and then we need a constant chain that runs right the way through. And increasingly, I think people do understand that. We can't wait for emergencies to hit though, because then the chaos is significant. So we need them to understand that and take steps now actively to integrate us into preparedness.
You mentioned some priorities. What are some of the other key priorities moving forward?
Okay, so I think we can break it into 4 areas, right? So to be properly prepared to manage a surge in patients coming in, so whether with an outbreak or trauma from an earthquake or a mass casualty incident, we need 4 things. We need our staff to be properly trained and to be integrated into planning. We need our space, so our rehabilitation facilities to be safe, and we need to be able to expand them if we can do. We need systems which capture data, and I think we've heard a lot this week about the importance of data on functioning outcomes, and that's going to be really, really key. So we need to be able to measure the impact of what we do and track patients as they move through. And we need the supplies. So we need to make sure that we've actually got access to the equipment that we need, and that we examine the kind of supply chains that we have so that we can make sure we can bring in additional supplies when we need to.
Thanks for that summary. And in terms of moving forward, if you had to have one strategy you would advise health systems to change with regards to this critical area, what would it be?
I think we need leadership. We need rehabilitation leadership to sit within the Ministry of Health when they're talking about their preparedness and response. So they need to be there through the preparedness planning phase, but they also critically need to be there sitting in the emergency operations centres when decisions are being made at the beginning of an emergency.
Awesome. Thank you so much.
Thank you. It's a pleasure.